I'm Sid with Ogden Clinic, here today with Dr. Nadim Bikhazi, ear, nose, and throat specialist, also known as the horse whisperer.
Thank you, Sid. We're excited to be here to help out a horse who's been having some difficulty. Got some friends around me, Dr. Mike Schuler, one of my colleagues in ENT, Megan, our speech pathologist, and Dr. Reese, the veterinarian, who has been in charge of this horse. And I wanted to ask Dr. Reese if you could just describe the condition that the horse has had and how common it is.
Sure. The condition is that started this issue was a paralysis of his left laryngeal, left larynx, and as a result of that, he wasn't able to obtain his normal airflow. And an attempt to correct that problem was a failed procedure where we tied the horse back with a prosthesis. Subsequent to that, we did a subtotal retinoidectomy, which has left him a nice big airway, but it seems to be that he's soiling his larynx and trachea with feed. We're not getting adequate closure over his rim glottis. So as a consequence, he's soiling himself and coughing and having issues with inhalation of debris down his trachea.
And then Mike, maybe describe what we saw last time. We came last week and put a scope in. Just describe what we saw.
Last time, a normal vocal fold should come together like this, and where the horse is paralyzed, it can't meet it all the way. And so what we would like to do this time is bring this over a little bit so that the good vocal cord can meet it, and then that way there won't be any leak into the horse's airway when he's eating.
And then maybe describe kind of what we saw, and we see with this in patients and deal with this a lot. Maybe describe the condition we see in patients.
Right, so when you have a paralysis of one of your vocal cords, you are sacrificing something. For the horse, initially it was the airway. We couldn't get that open enough to open up the airway for his racing status. And then with the procedure, moving it out and taking too much out, now he doesn't have the protection for his swallow. So the vocal cords serve two very important purposes, airway but they have to close to protect the swallow. So now we have a good airway, but we need to find the happy medium to protect that swallow.
Okay, so you got the background, so we'll move on to the procedure next.
So not only animals, but humans.
Humans, we have a clinic where we do the same thing with humans, so we're trying to help out a horse.
Okay. For more information on Dr. Bikhazi, visit us at ogdenclinic.com.